Hi, have you heard about a grieving spouse passing away within a few months of their partner's death? Grief is an emotion. We consider grief as a mental phenomenon. Can grief affect the body also? I'm delighted to welcome you for another episode of Mindscape Matters, a channel to discuss mental health and more. I am Dr. Mohanraj. I'm a consultant psychiatrist based in Chennai, and I'll be with you as we discuss different facets of mental health. Can grief affect the body? Yes, it affects the body in multiple ways. Persons who are in grief have a higher risk of death themselves in the first few months after their partner's death. They also have a higher risk of various physical illnesses or worsening of pre-existing physical illnesses. Let us look at the possible mechanisms for this. Grief increases the stress hormones. There is an increase in adrenaline, and this leads to many changes in the body, including an increase in blood pressure. You also know that adrenaline can constrict the blood vessels, and that is how it increases blood pressure. In addition, adrenaline acts on multiple receptors in many organs in the body. An increase in blood pressure can also lead to many end organ changes, and this can cause illnesses in these organs. Another stress hormone called cortisol can also be increased in the person who's grieving for up to 6 months after the death of the loved one. A prolonged high level of cortisol can increase the risk of cardiovascular illnesses, gastrointestinal disorders, in addition to other disorders. Another mechanism in grief is grief increases inflammation. Persons with grief were found to have higher levels of pro-inflammatory cytokines. Cytokines means these are chemicals which increase inflammation. In one study, bereaved individuals with higher grief severity had higher levels of the pro-inflammatory cytokines like interferon gamma, interleukin, and tumor necrosis factor alpha. This increased inflammation can cause tissue damage in multiple organs, including microvascular changes. When I say microvascular changes, these are changes in the smallest blood vessels that are all over the body in multiple organs. Another mechanism is grief brings down a person's immunity. A grieving person is more susceptible to infections which he or she would be resistant otherwise. Another mechanism is grief leads to changes in appetite. The person either has very less appetite or would be taking much less nutrition than what the body requires. Some people resort to comfort food, that is, they eat more and have consequences related to obesity. Yet another mechanism is grief affects sleep, and having less than adequate sleep has been linked to many illnesses involving the heart, gastrointestinal system, and other systems. Some of the above changes can lead to severe physical illness and sometimes death. That is the reason why some grieving spouse pass away within few months of the death of their loved ones. But this doesn't always happen. Many grieving persons do not die but can develop physical illnesses. One prime example of the grief and body connection is a condition called Takotsubo cardiomyopathy, which is also known as the broken heart syndrome. In this condition, the grieving person develops chest pain and shortness of breath. The clinical picture then proceeds to that of an acute heart failure. I'm not going into the details. Though the clinical picture will look like a myocardial infarct or a heart attack, the angiogram will show normal coronary arteries without any blocks. The echo shows ballooning of the left ventricle, that is, the left ventricle enlarges to an abnormal extent. It's literally like my heart is aching for you. The name Takotsubo cardiomyopathy is Japanese and is derived from pods used as octopus traps. These pods have a narrow mouth and a wide base. The octopus would enter these pods but would find it difficult to get out. The syndrome was named Takotsubo as the imaging studies of the heart shows the ballooning left ventricle which looks like these wide base pods. The good news is that broken heart syndrome usually resolves after a few weeks without much long-term consequences. Now, what causes these heart changes? It could be all the factors which we discussed in the beginning, like increased adrenaline and cortisol, increased inflammation and decreased immunity, and the consequence of all these. We just saw that grief, though considered a mental phenomena, also has many physical manifestations. This goes to show that the mind and body are interconnected and are inseparable. But we keep referring to mental and physical phenomenon or mental and physical illness as if they are separate. Why this dualism? Who is the culprit who first said that the mind and body are separate entities and are different? Let's explore this in the next episode. Thank you for watching this far. If you like this episode, please tell 4 of your friends. Tell them there is a Tamil version also. Stay tuned because Mindscape matters. Bye.